Hello doctors, this is Dr. Salman. So welcome to this high yield video session. So today we are going to discuss one of the important topic of gastroenterology, that is hiatal hernia. Okay, here we go. So first of all, starting with the definition, hiatal hernia is a protrusion of viscera, most commonly stomach, into the mediastinum through the esophageal hiatus of the diaphragm. Remember the different hiatuses of diaphragm? We have esophageal hiatus, we have vena-caval hiatus, we have aortic hiatus and small hiatuses, but here we are only concerned about the esophageal hiatus because through this esophageal hiatus the stomach, most commonly stomach, protrude into the mediastinum, and that is all about hiatal hernia. So hiatal hernia are found in 1/4 of patients with non-erosive GERD. So mostly in about like patients, like 1/4 of patients who are having non-erosive GERD, you may find hiatal hernia in combination with 3/4 of patients with severe erosive esophagitis and over 90% of patients with Barrett esophagus. So this is most important point to be noted because in all these cases, hiatal hernia are found. 1/4 of cases, non-erosive GERD, 3/4 of cases, erosive esophagitis, and 90% of patients with Barrett esophagus. Now we're coming towards the types of hiatal hernia. So broadly, we just divide hiatal hernia into two. One is type 1, that is also called sliding hernia. So either you can say type 1 hiatal hernia or you will say sliding hernia. Then we have second broadened type, and that is paraesophageal hernia. But paraesophageal hernia has subtypes, and these type 2, type 3, and type 4, they are under the heading of paraesophageal hernia. So type 1, this is normal anatomy. So type 1 is sliding hernia, and the second one is paraesophageal hernia, paraesophageal hiatal hernia, which is actually have subtypes, and subtypes of paraesophageal hernia is type 2, type 3, and type 4. So type 1 hiatal hernia is also known as sliding hernia, which I already told you, which is the most common or one about 95%. In 95% of cases, you will see this type 1 hernia. So the sliding hernia, the very important point to be noted here is that you can see the gastroesophageal junction plus this cardia. This portion is cardiac, right? It's a gastric cardia. So what we can see here, that gastroesophageal junction and gastric cardia both are here, both protruded from the this point esophageal hiatus into the mediastinum. So this is called sliding hernia type 1. So be noted, in type 1 you can see the protrusion into the mediastinum of two things. One is gastroesophageal junction and second one is cardia of the stomach. But here in type 2, that is a paraesophageal hernia, you can see that there is no protrusion of the gastroesophageal junction and there is no protrusion of cardia. But instead of that, you can see part of the fundus of the stomach is going parallel to the esophagus. So this is very important in this hernia, that you should be noted that there is no protrusion of gastroesophageal junction and there is no protrusion of gastric cardia. There is only the protrusion of fundus of the stomach or part of the stomach. In type 3, you can clearly see that both of these, so type 3 is actually the combination of these two. You can see the gastric cardia also here, and you can also see the fundus here. So fundus parallel to the esophagus and this also sliding. So this is a combination of both the sliding hernia and this one, that is type 2 paraesophageal hernia. In type 4, that is also a type of paraesophageal hernia, here you can see the colon. Most commonly the colon actually protrude into the mediastinum. So this is a highly dangerous one. It's a rare one, but it's quite dangerous. So what are the types? In type 1, you can see sliding hernia, gastric cardia plus gastroesophageal junction, both protrude into the mediastinum. In case of type 2, no cardia and no gastroesophageal junction, but the part of the stomach, the fundus of the stomach. In type 3, it's a combination of type 1 and type 2. You can see together, like both of them is there. First one is this gastroesophageal junction and cardia, and along with that, this protrusion of stomach parallel to the esophagus. And the type 4 is most commonly colon herniation into the mediastinum. So type 1 hiatal hernia is also known as sliding hernia. We already did this, which is the most common one. About 95% cases we see this. Type 2, 3, 4 are subtypes of periesophageal hernia. As I've already told you, broadly we have divided into 2. In sliding hernia type 1, the visceral content is gastricardia and gastroesophageal junction, as I've already told you, while in periesophageal hernia, that is in type 2, visceral structure is the stomach, mostly the fundus. Type 3 hiatal hernias actually are combined hernias in which not only you can see the gastroesophageal junction, which is herniated above the diaphragm, and the stomach is also herniated alongside the esophagus. So it's a combination. In type 4 hiatal hernia, which is periesophageal hernia, most commonly the colon herniates into the mediastinum. So this is an important point related to type 4 hiatal hernia. Now with type 2 and type 3 periesophageal hernias, the stomach inverts as it herniates. Of course, 2 and 3, stomach is also protruding. So when stomach is protruding, what happens? The stomach inverts as it herniates, and large periesophageal hernias can lead to an upside down stomach. And that can also lead to gastric volvulus and even strangulation of the stomach. So definitely that's why periesophageal hernias need surgical intervention, because of the chances, because of the risk, or because of the complication of volvulus strangulation. So periesophageal hernia needs surgical intervention like surgical gastropexy to prevent gastric volvulus. Very important point to remember. Now what are the risk factors? Risk factors, the incidence of sliding hernia increases with age. Age, weakening of the ligaments. So definitely there will be increased chance of getting sliding hernia, and sliding hernias enlarge with increased intra-abdominal pressure, like in case of coughing, in case of heavy weight lifting, swallowing, respiration. These are all the things which are coming in under the risk factors. Conceptually, sliding hernias are the result of wear and tear. Increased abdominal pressure, for example, abdominal obesity, pregnancy, can also lead to hiatal hernia. Smoking. How smoking? Because smoking causes relaxation of lower esophageal sphincter and hence exacerbate the symptoms. Fiber-deleted diet, especially in the case of periesophageal hernia. So these are all the risk factors. Now, what are the symptoms of hiatal hernia? Patients may be asymptomatic, they're not going to present any symptoms at all. Maybe it's an incidental finding on chest x-ray, you can see. But in patients with gastroesophageal reflux symptoms, like those who are having GERD, 1/4 of patients. So there you can see heartburning, chest pain, dysphagia. Now how you're going to diagnose? So diagnosis is frequently based on barium solo or endoscopy. Now how you're going to treat your patients? The best initial therapy is weight loss. Maybe lifestyle modification, you're going to advise your patient, and proton pump inhibitors. In case of sliding hiatal hernia, that's type 1, which are having GERD symptoms normally. If not controlled on medication, then we will go only for a definitive surgical treatment, and that is Nissen fundoplication. So whole 360 tie, you're going to tie the stomach, right? So Nissen fundoplication is a definitive surgical treatment, but you're not going to do this on priority basis. First, you will go for the lifestyle modification. You will go for the use of PPIs or symptomatic treatment. If not controlled, then only surgical treatment. Now for periesophageal hernia, surgical gastropexy to prevent gastric volvulus. So it's a definitive surgical, and mostly periesophageal hernias require surgical intervention like gastropexy. Now, what are the complications of sliding hiatal hernia? So, first and foremost, GERD, gastroesophageal reflux disorder. Other esophageal complications include maybe esophagitis, peptic stricture, periesophagus, like 90% of cases. Remember this one, 3/4 of patients, this one, 1/4 of patients. Now, extra esophageal complications include, so these are esophageal complications like periesophagus, peptic stricture, esophageal carcinoma. But what about the extra esophageal complications? That can also be there because of this hiatal hernia. It can lead to pneumonitis, pneumonia, asthma, cough, and laryngitis. They're associated, and they are actually, patients can complicate with all these situations. Now, complications of periesophageal hiatal hernia, especially. So the previous one is especially for the sliding hernia, and this one is for periesophageal, that is type 2, 3, and 4. So hemorrhage, because surgical intervention is there. strangulation, gastric volvulus obstruction, gastric stasis ulcer. So these are some of the complications of paraesophageal hiatal hernia. So what are the most important points you need to remember for this topic? First of all, that's a protrusion of most commonly stomach part into the mediastinum. Broadly, if you're saying this, the incidence of this with the patients like 1, 4, 3, 4, 90%. Types of hiatal hernia, the most common one, that's type 1. Most commonly, in case of type 4, colon herniates, right? For paraesophageal, you're going to do surgical intervention, risk factors, increase intra-abdominal pressure, fiber diet, smoking, symptoms, most commonly GERD symptoms, diagnosis on the basis of barium swallow and endoscopy, and treatment. First of all, you will apply for sliding hernia for type 1, you will go for lifestyle modification, just symptomatic treatment, not control, then definitive treatment, we have mesenteric application. And for paraesophageal, of course, surgical gastropexy. So complications, esophageal and this extraesophageal, and finally the complications of paraesophageal, most commonly this strangulation and gastric volvulus. So this is all about hiatal hernia. Thank you. See you next session.